Welcome to SeniorMedicareBenefits.com, moving healthcare forward, you and Medicare, what you may or may not know about Medicare Part B. What is Original Medicare? Part A, hospital insurance. Part B, medical insurance. Part B will be covered in this video. Who provides Original Medicare? On July 30th, 1965, President Lyndon B. Johnson made Medicare law by signing H.R. 6675. Medicare is sponsored by the federal government. What is Original Medicare Part B? Medicare Part B, medical insurance, is part of Original Medicare Part B and covers services and supplies that are medically necessary to treat your health condition. This can include outpatient care, preventative services, ambulance services, and durable medical equipment. Part B medical insurance usually pays only 80% of those approved charges. The approved amount may seem reasonable to Medicare, but it is often considerably less than what doctors actually charge. This means the doctor is accepting Medicare assignment. You are responsible for the remaining 20%. What does Part B medical insurance cover? Part B medical insurance covers most medically necessary doctors, services, or supplies, preventative care, partial hospitalization, limited outpatient prescriptions, durable medical equipment, second surgical opinions, hospital outpatient services, clinical research, laboratory tests, x-rays, mental health care, inpatient or outpatient, and some home health and ambulance services. What are Part B medical insurance costs? Part B medical insurance costs are you pay a premium each month for Part B if you get Social Security, Railroad Retirement Board, or Office or Personnel Management benefits. Your Part B premium will be automatically deducted from your benefit payment. If you don't get these benefit payments, you will get a bill for Part B every month. Most people will pay the standard premium amount. If your modified adjusted gross income is above a certain amount, you may pay an income-related monthly adjustment amount, IRMAA. Medicare uses the modified adjusted gross income reported on your IRS tax return from 2 years ago, the most recent tax return information provided to Social Security by the IRS. What are Part B medical insurance costs? The standard Part B premium amount in 2017 is $134 or higher depending on your income. However, most people who get Social Security benefits pay less than this amount. This is because the Part B premium increased more than the cost of living increase for the 2017 Social Security benefits. If you pay your Part B premium through your monthly Social Security benefit, you'll pay less than $109 on average. Social Security will tell you the exact amount you'll pay for Part B in 2017. You'll pay the standard premium amount if 1. You enroll in Part B for the first time in 2017, 2. You don't get Social Security benefits, 3. You're directly billed for your Part B premiums, 4. You have Medicare and Medicaid, and Medicaid pays your premiums. Your state will pay the standard premium amount of $134. What are Part B medical insurance premium costs? 2017 based on your income. Locate whether you are an individual or married and your annual income to get your monthly Part B premium. What are Part B deductible and coinsurance costs? You pay $183 per year for your Part B deductible in 2017. After your deductible is met, you typically pay 20% of the Medicare approved amount for these: most outpatient doctor services, including most doctor services while you're hospital inpatient, outpatient therapy, and durable medical equipment. How do I qualify for Original Medicare Part B? Most qualify at age 65 after getting Medicare Part A. Anyone who is eligible for premium-free Medicare Part A is eligible for Medicare Part B by enrolling and paying a monthly premium. If you are not eligible for premium-free Medicare Part A, you can qualify for Medicare Part B by meeting the following requirements. You must be 65 years or older. You must be a U.S. citizen or a permanent resident lawfully residing in the U.S. for at least 5 continuous years. You may also qualify for Automatic Medicare Part B enrollment through disability. If you are under 65 and receiving Social Security or Railroad Retirement Board (RRB) disability benefits, you will automatically be enrolled in Medicare Part A and Part B after 24 months of disability benefits. You may also be eligible for Medicare Part B enrollment before 65 if you have end-stage renal disease, ALS, also known as Lou Gehrig's disease. What are my options if I do not buy or qualify for Medicare Part A to get Medicare Part B? If you do not buy, qualify, or enroll in Part A or B when you are first eligible, you may have a penalty when you do enroll in Part A and Part B. You can enroll in Part B without having Part A. You can enroll in Part D prescription drug coverage without Part A if you're enrolled in Part A or Part B. If you are enrolled in Part A, you are required to enroll in Part B. What is a Medicare Part B late enrollment penalty? In most cases, if you don't sign up for Part B when you're first eligible, you'll have to pay a late enrollment penalty. You'll have to pay this penalty for as long as you have Part B. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B but didn't sign up for it. Also, you may have to wait until the general enrollment period from January 1st to March 31st to enroll in Part B coverage, and it will start July 1st of that year. Usually you don't pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. If you have limited income and resources, your state may help you pay for Part A and or Part B. You may also qualify for extra help to pay for your Medicare prescription drug coverage. Here's an example. Your initial enrollment period ended September 30th, 2009. You waited to sign up for Part B until the general enrollment period in March 2012. Your Part B premium penalty is 20%. While you waited a total of 30 months to sign up, this included only 2 full 12-month periods. You'll have to pay this penalty for as long as you have Medicare Part B. What is a Medicare Part B general enrollment period? Normally you'd enroll in Medicare Part A and or Part B during your initial enrollment period. This is the 7-month period that starts 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months later. Other people may enroll in Medicare Part A and or B before 65 if they have certain disabilities and receive disability benefits for 24 consecutive months. If you qualify for Medicare based on disability, including end-stage renal disease or Lou Gehrig's disease, you don't need a special enrollment period to sign up for Medicare. If you missed your initial enrollment period, you can also enroll in Part A and or Part B during the general enrollment period, the open enrollment for original Medicare that occurs from January 1st to March 31st every year. If you enroll in Medicare Part A and or B during the general enrollment period, it will become effective July 1st of that year. What is a Medicare Part B special enrollment period? A special enrollment period, SEP, allows you to sign up for original Medicare Part A and or Part B outside of regular enrollment periods. If you're not eligible for an SEP, you'll have to wait until the next general enrollment period to sign up for Part A and or Part B, and you may have to pay a late enrollment penalty for not signing up when you were first eligible. Certain situations may qualify you to enroll in Part A and or Part B using a special enrollment period. Some qualifying situations may include if you had other health coverage such as through an employer. I moved to a new address that isn't in my planned service area. If you were volunteering in a foreign country. If you have TRICARE and qualify for Medicare because of disability, end-stage renal disease, or Lou Gehrig's disease, or if you were living overseas when you turned 65 years of age. What is a Medicare Part B special enrollment period for the working aged? If you or your spouse are still working when you turn 65 and have group coverage through an employer or union, you can delay Part A and or Part B and then enroll with a special enrollment period when your health coverage or that employment ends. You may not have to pay a late enrollment penalty for not enrolling when you were first eligible. The health coverage must be based on current employment either through your work or through your spouse's employer. You can either enroll in Part A and or Part B while you're still covered through the group plan, or with the 8th month special enrollment period that starts the month that your insurance or employment that is based on that ends, whichever happens first. This special enrollment period occurs regardless of whether you decide to get COBRA coverage or not. Keep in mind, COBRA and or retiree health insurance don't count as coverage based on current employment and won't qualify for an SEP when it comes time to enroll. You also won't get a special enrollment period if your group coverage or employment ends during an initial enrollment period. In that case, you join Part A and or Part B during your initial enrollment period. What is a Medicare Part B special enrollment period for international volunteers? individuals volunteering in a foreign country may be able to enroll in Part A and/or Part B with a special enrollment period when they return to the United States. To qualify for a special enrollment period, you must have volunteered for at least 12 months outside of the United States, have volunteered for a tax-exempt program, have had other health coverage for the duration that you were overseas. What is a Medicare Part B special enrollment period for disabled TRICARE beneficiaries? TRICARE is a health insurance for retired and active duty service members and their families. If you're a retired service member, you must enroll in Part B to stay eligible for TRICARE benefits. However, TRICARE beneficiaries who qualify for Medicare based on disability, Lou Gehrig's disease, or end-stage renal disease may qualify for a special enrollment period if they didn't sign up for Part B during their initial enrollment period. The 12-month SEP starts on the last day of the person's initial enrollment period or the month that the person is notified of Part A enrollment. This special enrollment period can only be used one time during the TRICARE beneficiary's lifetime. What is a Medicare Part B special enrollment period if you were living overseas? There are other situations where you can enroll in Medicare outside of normal enrollment periods without a special enrollment period. This includes if you were living in a foreign country when you turned 65 and were first eligible for Medicare. Since you need to be living in the United States to have Part B, you can sign up in the first month after you return back to the country. This only applies if you were overseas and not receiving Social Security benefits when you turned 65 years of age. Otherwise, you may have to pay a Part B penalty when you move back to the United States. For more information on Part B enrollment for U.S. citizens living abroad, contact Medicare at 1-800-MEDICARE, 800-633-4227. If you're a TTY user, call 877-486-2048. Customer service representatives can be reached 24 hours a day, 7 days a week at Medicare. Why are Medicare Part A and Part B so important? You are not allowed to enroll in a Medicare Supplement health insurance plan or Medicare Advantage health insurance plan without being enrolled in Part A and Part B Original Medicare First. This concludes SeniorMedicareBenefits.com, moving healthcare forward. You and Medicare, what you may or may not know about Medicare Part B. Catch more valuable information at SeniorMedicareBenefits.com.